Good afternoon, ladies and gentlemen, and welcome to January's local COVID outbreak engagement board meeting. Notice of recording. I have to advise that this meeting is being recorded, webcast, and will be available for subsequent broadcast on the council's YouTube site. Anybody who's in the meeting may record themselves and indeed take photographs of the meeting if they choose to do so, except where there are confidential or exempt items, and we do have an exempt item at the end of today's agenda, so we will be going into private session for that. Can I ask anybody who wishes to speak, please to indicate by raising your electronic hand, and if you could help with people's bandwidth by remaining on mute and turning your video off when not speaking, but obviously when you are speaking, obviously switch your mic on, but do also switch your video on as well. I have a number of apologies for today's meeting. First of all, from Councillor Bridget Jones, then from Dr. Mir Aslan and Chief Superintendent Steve Bryan. Are there any others? If not, then if we could note those apologies. Item 4, declarations of interest. Does anybody wish to declare an interest in respect of today's agenda? Not seeing any hands on that. So we'll move on to the minutes then. We're asked to confirm the minutes of our meeting held on the 15th of December. Are we content that they're an accurate record?
Great.
Agreed, thank you. 4. Item 6 then is the COVID-19 situation update. Justin.
Thank you, Leader, and I will share my screen and just take the board through the slide deck. I won't cover in detail, but I'll try to pull out the highlights for the committee in terms of the key points from this month's report. So there have been some significant changes in terms of the policy position, and as of Thursday, the 27th of January, COVID passports will no longer be legally required to gain entry to venues and events, and mandatory face coverings will no longer be legally required in public spaces, indoor venues. However, it remains advisable to wear face coverings, particularly when entering crowded and enclosed spaces. And there are also further restrictions in being relaxed in relation to visits for care homes. The vaccination programme continues to move forward, and one of the steps that has been recently announced is that children aged 12 to 15 will be able to use the NHS COVID pass from the 3rd of February. So that's being updated, and that will help those who are taking their children overseas, because it's quite a useful tool. Many countries are now requiring COVID passes to eat indoors, for example, or to attend venues like cinemas. From Friday the 11th of February, there's also a change in terms of individuals returning to the UK, and there is no longer a need for a day 2 test within 48 hours of arriving if people have been double vaccinated. Still require the passenger locator form, and those who are not fully vaccinated will be required to take a pre-departure test and a test on or before day 2. After their return to the UK. So it is important to remember the pandemic is not over yet, and we're still seeing significant pressures. The evidence from other countries like South Africa is we will see the case rates continue to rise for a little while, and we will see the pressures in the NHS and unfortunately in deaths for some time, several weeks yet to come. So I think it is important we all remain cautious. And just because there isn't a law forcing us to do something doesn't mean we should stop practicing sensibly in the context of this infectious disease that still remains common in our communities. Just looking across the total pattern, it is a slightly complicated picture in a sense that although we're seeing some signs that the case rates have fallen a bit, they're now starting to plateau, which means that they're kind of getting stuck. And the question is whether they'll continue to fall or whether we'll start to see this being kind of background level of Omicron for a little while. And that's some of the pictures we've seen overseas. So we're definitely not out of the woods yet. And that's the trend across Birmingham, the Black Country. We're pretty similar across the region in terms of direction of travel, the kind of patterns we're seeing. And as you can see from the maps of the city, Omicron has really changed the dynamic in terms of we're seeing high numbers across the vast majority of the city. And unlike previous waves where we saw clustering, particularly in areas which were more deprived, we're not seeing that in this wave. And in some senses, when we look at the wards that are more effective at the moment, they are some of our wards where we have the higher vaccination rates, and these have been more affluent wards. What we think may be going on here is we know that after you've had the vaccine and the booster, for a couple of months, you have really strong protection against reducing your chances of catching the virus, reducing your chances of passing it on, and reducing significantly your chances of ending up in hospital or dying. After about 10 to 12 weeks, that protection against infection starts to decline, and the protection against serious illness stays for much, much longer. And we're seeing that seems like it's going to last for 6 or 7 months. But the protection against infection, which is not perfect, but is there, starts to decline quite quickly. So what we think may be happening is some of the areas of the city that have been, over the last couple of weeks, seeing really high case rate rises, is some of the areas who were very good at getting their vaccine efficiently early on in the summer, got their booster early on, and because that booster's protection against infection has started to dip down, that's why they're seeing their case rates pick up faster than other areas that vaccinated a bit later. What is really good news is that those areas have not seen an increase in patients going into hospital. And that's really demonstrating that the vaccine does exactly what it says on the tin, which is stop you dying and stopping you getting seriously ill. It does give some protection against infection. It does reduce your chance of passing it on, but it is not perfect. We look also at what's happening in terms of the ONS COVID infection survey, which is a random population, or representative, population sample, and that suggests that there has been some decrease in the percentage of people testing positive, but it is not as significant as the decrease nationally. And our wastewater picture suggests that we're still seeing some decline, but it's not out of the woods yet. When we look at variants of concern, Omicron is the dominant variant. We have now discovered a subvariant of Omicron, which is called a variant under investigation. It's a very small number of cases across the UK. And we're still learning what this subvariant means in terms of does it make any difference to the vaccine or anything else. So UK HSA are leading on that, and I hope at the next board to be able to give more information. So you can see from numbers, this is very early days in terms of this variant or sublineage of Omicron. In terms of testing, the move now very much is to the postal channels, and we've seen a massive increase over the period between Christmas and now in terms of people being able to access testing kits through the national website, getting them sent to home for lateral flow kits. And similarly, our PCR capacity has also increased significantly nationally. So we've maintained a good footprint of symptomatic testing sites, but we've been standing down the community distribution sites for the lateral flow rapid antigen test, because the vast majority of us should be able to go online and order a kit and it arrives within 48 hours. And there now seem to be no supply issues. And when we look at the numbers that have been ordered across the West Midlands, there's a massive increase from where we were before Christmas. The council is now focusing its efforts with the lateral flow kits that we have on supporting people that are most disadvantaged and least likely to be able to access the online ordering system. And we're working with charities and voluntary sector organisations across the city to enable that with the resources that we have. Testing uptake across the city is relatively even, and although it's a bit patchy around the centre of the city, this is the PCR picture, but the lateral flow, you can see the centre's a little bit paler. These are still significantly higher rates than earlier parts of the year. So overall, I think the message is the city is doing a good job with the regular testing twice a week with the lateral flow kits. We've seen good compliance with people testing children before they go to school, and that is definitely picking up positive cases. And as you can see in the age profile, we had this blip at the return to school, and it's now returned to kind of a more stable level. And that's exactly what I would expect to see at the beginning of term in terms of school-age children. Big spike in testing over that first 2 weeks, and then dropping back down to normal levels. We're not seeing significant variation between different ethnic groups. There has been some rise in this line, which I think is the Arab population, but it's a small community, so I'm less focused on that variation. Similarly, the pattern in terms of deprivation has remained pretty consistent. Looking at our cases across the last couple of weeks, similar proportions and similar downward trends in most communities. What we are seeing, though, is that the 0 to 19 age group is remaining more higher than other age groups. And this is reflecting also the national picture that Omicron continues to spread amongst children. Fortunately, there still seems to be limited impact of COVID on children, particularly in terms of acute illness, but it is something we continue to monitor closely. In good news, we've seen the case rate in the over 60s really starting to come down now. We're seeing a drop in the number of care homes where they've got outbreaks, which is good news. And what's also really positive is that this spike in cases did not seem to translate into a significant spike in hospitalizations for the over 60s due to COVID. And that's really demonstrating the impact of the vaccine and the boosters. Just moving on quickly now to the NHS context, I think it is important to remind the board that the NHS remains under significant pressure, and these are much, much higher numbers in terms of inpatients with COVID than we saw earlier in the year. However, what is really positive is the number of patients requiring machines to breathe for them is much lower. And this is the difference that vaccination is making. Although people are unfortunately requiring short stays in hospital, and we're seeing vaccinated patients do end up in hospital, but generally not with COVID, with other things. But if it is COVID bringing them in, they're sick for a few days, they need a couple of days support, but they're not requiring the weeks and weeks of support that they were when we didn't have the vaccine, and much smaller proportion of them are ending up in intensive care. Whereas the majority of patients we see in intensive care because of COVID are unvaccinated. So this really is pushing the point and making it very clear that the vaccine is making a big difference to the impact of COVID on the NHS. But as I said, the number of admissions remains relatively stable at the moment, and I would expect this can continue for about another week or two before we start to see a significant decline. And moving on to the deaths, we are starting to see those in terms of absolute numbers creeping up a little bit. I wouldn't expect to see the impact of the rise at the end of December, at the beginning of January in the death data for about another week or two. So I'm suspecting that we will see some increase in death numbers starting to appear in the next 2 weeks. What is very positive is that over the December period, we didn't see a significant increase in non-COVID deaths. There are other parts of the country where that grey bar that goes above the blue line, the average for the last 5 years, was quite significant. And that was a big challenge for us in the first wave of the pandemic, where people were very scared. They weren't calling the ambulance when they needed it. They weren't able to get the care and help that they needed. And unfortunately, were dying from other things as well as COVID. And we haven't seen that in the most recent surge and period of restrictions, which is really positive, and I think reflects the hard work of the NHS to ensure people know that if they need to be seen, they will be seen, and that the NHS has remained open to business across primary care through this period. In terms of our situation picture, we continue to see pressure from our education settings. However, that is decreased a bit over the Christmas period, but has now increased significantly since schools reopened. And we have seen an increase in clusters in care homes. However, as I said before, what's fortunate is we're not seeing that associated with significant hospitalisation and death, which is good news. And as you can see, the education numbers do dwarf the rest. And last week, I think it was a week before last, sorry, we had a particularly heavy week in terms of over about 140 odd school-based settings that we were supporting through the Outbreak team and the council. So still a significant workload in terms of supporting organisations about outbreaks. Contact tracing is going well. We have increased the capacity within the contact tracing scheme to cover more wards and to provide follow-up. And as you can see, we have been handling still thousands of calls a week in terms of following up for welfare support, but also in terms of following up people that Test and Trace were unable to find. We have been working with NHS Test and Trace as they've updated the information on welfare support. We've moved to stop the letters being sent to positive cases because it was felt to be a replication of work, and to some extent it was some citizens had told us it wasn't particularly helpful given they were getting the information from Test and Trace. We continue to keep that under review to ensure that people aren't falling through the net in terms of people that don't necessarily have a smartphone and may not receive the SMS information. The majority of contacts continue to be household, and that remains the main space of transmission that's been identified. In terms of communication and engagement, we continue to work closely with the NHS to support the vaccination programme, but also to help communities and citizens understand the changing national guidance, and that includes translating materials, using our social media platforms to promote information, doing engagement sessions. We are working, for example, with the Chinese Community Centre tomorrow. I'll be doing a Q&A session with our Chinese community with simultaneous Mandarin and Cantonese translation, so that language shouldn't be a barrier for people being able to ask us their questions and raise their concerns. And these are just some examples that we've been doing over the last few weeks that are included in the pack for you. So I hope that's a useful overview in terms of what we've been up to and where things are at in the city. As I've said, I would ask people to remain cautious as we go through the next phase. Omicron remains a significant challenge, and particularly people who are unvaccinated or have not yet completed their 2 doses and had their booster. And we can all continue to play our part by washing our hands, wearing a face covering where we're entering enclosed spaces that are crowded or with lots of people that we don't live with. And ventilation is perhaps the key message now. Opening those windows before you have people over or when they leave really helps reduce the risk of there being a cloud of Omicron sitting in the air for you to walk into. So I think the message is keep alert. We still have, unfortunately, a bit of a way to go, but it definitely looks like things are improving.
Thank you very much, Justin. If anybody has any questions or comments, please do indicate. I have one question myself, Justin, and that is, leaving aside the possible further variations of the virus coming forward, just on the issue of the waning effectiveness of the vaccines over time, what is the thinking now about whether there will be need for a further booster jab for people?
Thank you, Leader. So my current understanding of thinking is that the 4th dose is only required for individuals who the NHS have identified have significantly impaired immune systems. So if you've received a letter from the NHS that explicitly says you're being invited for a 4th dose, then please do pay attention to that. Please do go in and make that appointment. For the rest of us, the evidence is that the booster dose is enough to deal with Omicron. What I suspect will happen is, because the vast majority of the world is not yet double vaccinated and boosted, is that we probably will need a annual COVID jab in the autumn alongside the flu jab, to protect us against new variants that appear around the world. And we'll probably need that for 2 or 3 years until the vast majority of the world is vaccinated and COVID's run out of places to go. So I don't think it will be a fourth jab in the context of another booster, but I do expect that in the autumn we may well have the start of an annual COVID jab programme. I think we still need to wait and see what JCVI advise, and it may not be all ages, it may be specific groups, but that would be my crystal ball gazing at the moment, Leader.
Thank you very much, Justin. That's very, very helpful. I'm not seeing any hands on this or any further questions, so I'm going to suggest that we note the situation update that Justin has just given, and we'll move on to the vaccination rollout and uptake. And we have Paul Sheriff, NHS Birmingham and Solihull CCG, who's going to take us through this. Paul.
Thank you, Leader. And in everybody's pack, there are a set of slides, I think, that have been circulated. But as with most things that Justin's just taken us through, the vaccine programme continues to move very rapidly. So I'll just take you through a few key headlines and then take any questions that follow. Since we last spoke to colleagues on this board, things have changed significantly. The booster programme had a real drive and a push in December. We've now delivered over 500,000 vaccines within our system, booster vaccines that is, and that's about 74% of those eligible. And that's in addition to the 800,000+ first doses have been delivered and the nearly 750,000 second doses. So as the Director of Public Health has just pointed out, we really do need citizens to come forward and complete their vaccination programme and take up the offer of a booster, because we still have a way to go. That picture, whilst we're very proud of the volume of vaccines delivered, does not reflect actually there are certain communities and wards where we still have further work to do. And I shall come on to that in a second. So what we are seeing, the picture at present, is the booster vaccine programme is tapering off. There was high levels of demand when it was very much in national and local focus, but we're seeing that tapering off in January. So that remains an area of action. I think rather significantly, all of our delivery routes, so our mobile vaccine units, our vaccination centres at places like Millennium Point and Grand Central Station, as well as our local GP sites, all remain open. And they are offering a combination of locally booked appointments. Some of them, or very many of them, offer open access for citizens to just turn up and have a vaccine, as well as booking through the national booking system and via the website. So in terms of the focus of our activities over this current period, it's clear to us based on the data that we have more work to do, certainly in the east and the west of the city around the booster programme, specifically for those over 40 and above. There is an awful lot more work to do for school-aged children between the ages of 12 and 15. And there is a challenge there because the current impact of Omicron is leading to kind of school absence. So there's a challenge there to get visits within schools. And coming up towards the end of this month, the JCVI have authorised vaccination for children aged between 5 and 11 years with underlying health conditions. So in terms of the next steps, really, the focus of our plan is around continuing to build confidence, addressing some of those hesitancy or complacency issues, both of those through really good community engagement and communications. And again, in the slide pack that you've just seen from Justin, some of those examples were set out in there. And then ideally, and to continue with all of our providers and increasing those with community pharmacy support to provide convenience for citizens. So making the vaccine available so people can book it at a time that is convenient to them and a location for them. So I will pause there for breath, Leader, if that's okay. I can see there's already a question come in from Mr. Burden, and I'll happily take questions as they come through.
Thanks very much, Paul. Yeah, let's pass over to Richard. Richard.
Thanks very much, both, and thanks for that report. Just look at your slides there, Paul. You know, the vast majority of take-up of the boosters has been at the local vaccination centres. And I just wonder if we've got, or whether it'd be a good idea to get down to a bit more granular level about that, about how people are getting their boosters. I mean, how many are getting booked appointments and how many are using the walk-in service? And the reason I say that is because the spread of the walk-in service, whilst it's very, very good in some parts of the city, in other parts of the city, it's actually quite patchy about whether there is a walk-in centre in easy reach of a lot of people. And so if actually where the walk-in centres are showing themselves to be very effective at picking up people who've not been vaccinated or boosted so far, that might indicate there needs to be a look at trying to get the spread more consistent across the city. And I particularly think that in relation to the problem that we've got in relation to younger people. I don't just mean school age young people, but the under 30s and particularly the under 25s, where there is still quite a lot of hesitancy. And we just do need to, I think, button out about whether actually offering the facility to say, if you fancy doing it today, just go and do it, whether that's important, and if we need to, and whether we need to get that coverage of the walk-in centres, as I say, more consistent across the city.
Yeah, go ahead, Paul.
Yeah, it's a very good question. I think there is most definitely an action for me to take away and look at that in more detail. We have a significant amount of data actually that goes down to quite a granular level. I can clearly take that away. I think I will look at the availability of open access. We do tend to see a mixed model. So they will offer open access on certain days. I think part of the point that's just been made is around a consistent offer, so people know where they stand. But if that's agreeable, I will take that away as a specific action and provide a response.
That's really helpful. Thank you.
Thanks very much, Paul. Let's take the next two questions together. So starting off with Matt.
Thank you. Thanks for that presentation. I'm just a bit concerned about the sort of difference between those who have their second jabs and the boosters, because I think, did you say it was 74% of those eligible have had the boosters, and most people who had 2 doses would be eligible for boosters? So that means that 25% of people who had their second jab haven't yet had their boosters, even though they've had sort of ample time and lots of encouragement to do so. I just wondered if you've got any thoughts about why that is and what more can be done, because I think there's a difference between the sort of hesitancy to get it done initially. We're sort of clear about that, but I'm not quite certain why there would be a hesitancy having had the first 2 jabs to then go and get the booster. And it's a bit concerning that there are such a number of people that are doing it.
Okay, just hold fire, Paul. Let's take the other question first, and then you can respond to both. Stephen.
So we're now in a situation where there are a number of providers across social care trying to establish who must have the vaccine as a part of the mandatory vaccination programme. I'm wondering whether, as we move towards the ICS, where there is a gap between the guidance available at national level and what needs to happen on the ground, and there's some ambiguity, we could look at some of those risks being owned by the system and additional guidance being produced at a local level, because lots of them are trying to answer the same question, and it's quite, well, it's expensive, and it leads us to a less coordinated response.
Oh.
Nothing like some tough questions. The first question around the uptake of the booster, I don't have a definitive answer, Councillor. I think it's to me, it's very disappointing that people that have had their first 2 doses and are eligible for a booster dose haven't come forward, despite all of the national and local publicity and engagement. We've undertaken a range of exercises, not just general comms, across a number of platforms. We've used local GPs to reach out to their patients. We've used material through people's front doors. We've knocked front doors. We've phoned people and SMS texted them. Anecdotally, I think it comes down to a degree of apathy, or perhaps a sense that I don't feel I need it, that Omicron is a mild disease, that this wave is passing. But we've made it very clear in Birmingham that we will continue to do two things. We will continue to offer the booster to those that are eligible, and we will continue with an evergreen offer. I think the really important thing is that we do some more insight work with communities to understand what sits behind that, what sits behind those decisions, and then we respond with our plan for the next phase to still encourage people to come forward. But there's no specific answer about why people haven't come forward, despite the work that we've been doing. I have to say, I think it's a consistent pattern across other regions, and certainly the slowing down of the uptake of the booster programme as well. In relation to the second question about the impact, Stephen, if I've understood you correctly, around other parts of our system, I would like to think within the Birmingham Health and Care System that we will continue to work as one on this with all partners. If you've got thoughts or ideas about how we can join that up better to provide that support and resilience to other parts of the health and care sector, then I'll gladly work with you. We have had a number of forums and mechanisms in place where we've worked with a range of providers to provide that support. But if that needs to evolve or that needs to be enhanced further, very welcoming of that advice and that insight. Thank you.
Thanks, Paul. Let me bring Justin in. Justin?
Thank you. I think Paul, just picking up on that last point, it will be really helpful for both CCGs to have an identified point of contact for commissioned services to contact to ask, because like Stephen, I'm getting a lot of questions from a range of things, from optometrists who are commissioned to do diabetic eye checks, for example, through to mental health support workers. And there's a range coming through from a range of different commissioners, I think, within the NHS system, but there doesn't seem to be a clearly identified point of contact for us to be able to direct them to have a conversation about what's sitting within the framework of the overall national guidance, which is quite broad in its definition of who's included in the context.
Thanks, Justin. I take that comment, that's very helpful. I'll pick that up as an action, Justin. We have a kind of mechanism, as you know, across some of the statutory partners around interpreting the national position and what that means locally. I'll pick that up as a single point of contact. It would make sense to me to do that as one contact for Birmingham. So again, we'll link across to both systems.
Thank you. Just finally from me then, Paul. The government has set a date now for NHS staff to be vaccinated. We've seen reports in the media about potential staffing issues as a result of that. I wonder if you're able to say anything about how that is or might impact in Birmingham and Solihull?
Yeah, thank you, Leader. I think it's fair to say that it remains very challenging. There is a risk there. Levels of vaccine uptake are, I think, very, very significant across all providers. However, there will be pockets in certain geographies within teams. So it is an area of concern. It has daily, if not weekly, focus of executives and chief executives as we work through that guidance to understand where the actual risk will really sit and what can be done to mitigate it. And all of the support officers, you would imagine, are in place for staff to talk through any concerns, any hesitancy issues, and to, we've said no question is all questions are good questions. So we'll continue to work that through. But it is fair to say there is risk locally. That is understood, and that is being worked through to see how that's mitigated.
Thank you. Paul. I'm not hearing you at the moment, Paul.
Apologies. I gave a really good answer, but didn't turn my microphone on.
No, sorry, I'm confusing matters now. It's Paul Tilsley I'm trying to bring in, who's indicated that he wanted to speak. I don't know what's happened there. There may be a connection problem, but we're not hearing Paul Tilsley. Aaron?
Can I ask a question, Chair?
Yes, sure.
it's in relation to the people not taking up the third or the booster. I'm just wondering if it's due to the fact that some people may have contracted COVID, and then when it's time for them to have the booster, they can't have it because they may be having COVID. Because I know that has happened with a couple of my sons.
Yeah, it certainly puts a delay, doesn't it,
Yeah.
at the time at which you can take the booster. Thanks, Darryl.
Just to come back on that,
Yep.
Leader, that's most definitely the case. We have had that, and we do recontact people to bring them back after that period of we don't have to kind of wait for that gap. So we will kind of follow that through. Yeah, but it is a fair point, Errol. That does cause delay.
Thanks very much. Paul Tilsley.
Can you hear me now?
I can hear you now, yeah.
The marvels of modern technology. The issue that you raised, Ian, is something that I raised yesterday at Health Scrutiny. The Times at the weekend had some very telling figures, and you were able to break down to individual trusts. And I did that as far as Birmingham was concerned. Given that overall there's a shortage of 10% in staffing levels, when you look at the unvaccinated staff within trusts, it is quite worrying as far as Birmingham is concerned. And obviously with the fallout that there has been with elective surgery for a whole variety of procedures, it does concern me that we're pushing it even further back.
Yeah, and I think Paul was explaining that there's mitigations in place in every effort to encourage people to come forward. But I don't know if you wish to add to what you said earlier, Paul.
Thank you, Leader. I think it's largely covered. I do take the point that Councillor Tilsley makes. That is a concern. We're not ducking the fact that there is risk there. It's very much on the agenda every day to see how the uptake rates are increasing and the mitigations to address it. And it's something that we will continue to be very transparent on in our reporting.
Thank you very much. I'm not seeing any more hands. Oh, Paul Tilsley, do you want to come back?
No. Just thank you. Thank you.
Yeah, thanks, Paul, for that update. We will note that, and we'll move on to the next item, which is the schools update. And we have Jaswinda Didari, who's Head of Service for Education Infrastructure with Birmingham City Council. Jaswinda.
Thank you, Leader. I will share my screen, if that's okay. I know we've shared the PowerPoint with colleagues. So let's see. It's always a challenge, isn't it, to make sure you pull up the right one. Okay, maybe it's, here we go. No, I think I don't have the right one.
Oh.
Just bear with me. Right, okay. Here we go, schools update. Okay, so very quickly, I'll go through the main point. So I'm just going to take the board through the attendance, particularly COVID attendance data for Birmingham schools, the current guidance for schools and the impact of COVID on Birmingham schools, how we are working with other agencies such as Children's Trust to support vulnerable pupils, and then further on joint working with education and skills and public health. I think Justin alluded to that. I think we're keeping our public health colleagues fairly busy. And then our plans for the remainder of the half term and then possibly the academic year as well. So if I can take the group through some data. So it's really important to remember that this data was taken as at Thursday, 20th of January, when we submitted the information. So it fluctuates. So it is a snapshot in time. But if we look at last Thursday's data, what did attendance look like in our Birmingham schools, where we were at 85.4% compared to a national figure of 87.3%. But if we look at the core cities and our statistical neighbours, and particularly West Midlands, we are there or thereabouts. And if I then tell you that when I looked at yesterday's data, our attendance figures are up. But when I compare the Thursday, the 20th of data to Friday, the 21st, our attendance figures were lower. So it does fluctuate, and it's usually by 0.1 or 1% or thereabouts. So that's for schools overall. If we break that down to different phases, primary, secondary, special, so you can see that in primary, so these are pupils actually attending on site, 87.7% in primary, 83.8% in secondary. Specials lower, 67.9%, understandably, because of the vulnerability of the younger pupils. And then you've got other groups, the data broken down. And then in the right-hand column, there is the comparison to national statistics there as well. So that's the overall attendance. If we then break that down further to actually COVID-related absence rates, so this is including confirmed, suspected, not vaccinated, and other. For our state funding schools, this was at 5.7% compared to the national the national average of 5%. So we were a little bit higher in terms of our COVID-related absence. And again, on the slide, there's a breakdown of data in different phases as well: primary, secondary, special, and other groups. So the guidance for schools, we continue to work quite closely with the schools and particularly with our public health colleagues. We offer regular update on guidance and support the schools. As Justin alluded to earlier, the start of the term is always busy, and there was no different to this start of this term. I think Justin said there were over 100 calls that we were that public health colleagues were dealing with and supporting the over 100 different schools and settings. We've been working with our colleagues quite closely to reinforce the messaging around ventilation, around hygiene, and the use of face coverings. And we obviously need to work. We're also updating schools on the guidance that's coming out from DFE as well. And included in that is messaging around lateral flow testing and also the isolation if staff or children are displaying symptoms. We continue to encourage the school community to take up the vaccination and boosters when it's available. And in terms of enabling schools to manage manage the situation within schools, we have now changed our risk assessment to outbreak management plan. If those colleagues that may be interested, if you click on the link, you will see what that looks like. And obviously the outbreak management plan will look different for, there will be certain subtleties within each outbreak management plan according to the school situation. Our schools continue to work with health protection teams in cases of local outbreaks, and we continue to support the health protection teams in terms of meetings with schools and supporting them to ensure that vulnerable pupils' needs are being met, and offline those pupils that need to stay at home, there is an offline offer which is strong, and so that there is education continuity. when local health protection teams advise schools to consider additional measures, which may include temporarily restricting attendance, so that's partial closure of a school, or in some cases it's a full closure of a school, particularly during an outbreak, and if other measures to contain the spread they haven't worked. So we continue to support our health colleagues and schools with managing that. The current situation in Birmingham schools, we had a very well attended webinar at the start of the term, and it was really well received, which was hosted by Justin, and we are hoping to do repeat that, and that's been the picture throughout the COVID period. Really, schools really benefit the opportunity to ask any questions that they might have, and following that, we always produce a frequently asked question sheet, and we provide a platform for schools to ask any questions that they felt they may not have had an opportunity to ask, or they may have identified a need later on. We have been in touch with our school leaders to ask for some feedback, and some of the issues that they have raised since the start of the term are around the overall morale and well-being in school staff being affected due to the continued challenges that they're facing. There is anxiety within our school community, parents and staff, about the rising cases. Schools are encountering issues with the capacity to cover large numbers of staff, which are isolating, and that picture hasn't changed. We know that in a particular geography, for instance, all of the schools will be tapping into the same agency to have some supply staff. So that does remain a concern for our schools, and we continue to support them. Schools did have difficulties in ordering LFD test kits, and we raised that with our DFE colleagues. We do have regular meetings with them, but I think that's easing now. And the other issue that remains live for our schools is the ventilation. The ventilation arrangements. We've just undertaken a survey regarding the ventilation, and I will be able to bring an update on that to the group at our next meeting. We're just collating the responses. In terms of supporting our vulnerable pupils, we are working closely with our colleagues within Birmingham Children's Trust to ensure that the right support is in place for our vulnerable pupils throughout the pandemic. The schools are aware that they can submit referrals using Right Help, Right Time threshold document, and this is for any children that they may be concerned about. And they also are aware that there's Family Connect form it can also be submitted, or other professional by schools or other professionals to request support for families through the early help system. The early health services contacts and visits children of concern that are not open to social workers. So it's not just for families who are known to social worker teams. There's support for other families as well. And social worker team managers linked to schools provide general support to schools, and that position has remained static and continues to be the case moving forward. So just to summarize, in terms of our support for schools and settings, Outbreak Management Plan templates was produced by us, used by all schools, and we also offer support if school is struggling to complete that template. We've held regular webinars throughout the period, and we will continue to do so, and those are really well attended. And the webinars are on a range of subjects, which includes webinars with public health on the current situation. We've also had webinars on ventilation. We've had webinars on keeping on compliance checks on buildings, etc., on admissions. So they are really wide-ranging. We remain in close liaison with our Birmingham Public Health and UK Health and Security Agency. So that work and that collaboration is really important. And other documents produced by our public health colleagues are the frequently asked questions, checklists and flowcharts. As you can imagine, as the guidance change, it is really important for us to make sure that those documents reflect the latest guidance. So they are under constant review. And then we also send regular bulletins to schools, updating them on any changes in guidance and reminding them of the help and support that's available to them through our school's notice board site. So just very briefly to take you through the plans for remainder of the academic year. We are working with our school improvement partner, BEP. This is to ensure that there is support for pupils with catching up, particularly those that have lost time in their learning. And then schools who are experiencing temporary or partial closure, we are working with BEP to ensure that the remote learning offer is robust, and the schools and families have got the support that they need to access that offer. There has been a spotlight from the Education Department and through Council on statutory services on children who may be missing education, particularly children who are on school roll but have been persistently absent during the recent COVID period, and children who may be on part-time timetables. And he also includes children who are not on roll, and one group is, for instance, those parents who have elected to home educate. And then additional resources have been allocated to children missing in education team. And this is particularly a team that focuses on children where their whereabouts are not known. And this is in response to the increased activity in that area. We continue to work closely with Forward Thinking Birmingham and Education Psychology Services to support the mental health of children and young people and staff in schools and settings. And we, as I've said earlier, we will continue to support our schools through webinars, ensure that the guidance is updated, support is provided in sometimes in deciphering what the guidance actually means, and then through regular communication with schools. Lisa, any questions on that?
Thank you very much, Jessica. We shouldn't lose sight of the final point you're making on that last slide, that children and young people, not just across Birmingham, across the whole of the country really, have had a really tough time last 2 years, missing out on education, particularly those in deprived communities that have perhaps not had access to IT, have suffered most, and there is a real need to address that catch-up element in young people's education. Going forward. So has anybody got any questions or comments on what we've heard? I think all in all, Jazz, you're doing a great job there with your team, obviously, in supporting schools throughout the city. So thank you for that. And I'm not seeing any hands. So thank you. We'll note your report. Thank you very much.
Thank you, Leader.
Thank you. The next item is public questions submitted. I don't believe there's been any public questions submitted, but there may be an issue around a survey. Heidi, are you going to? Oh no, sorry, Justin, you're going to speak to this.
No, I was going to say Hedi's going to present this item, Leader.
Okay, over to you.
Hi, Leader. Let me share my screen.
Yeah, we can see that.
Yeah. These public questions arose from the trying to understand the reasons why people either take the vaccines or why we're having low uptake of vaccines in the community. We sought to pose 6 different questions, essentially trying to understand their knowledge, understanding of why we're asking them to take the vaccines. Can you see that?
Yes, we can see it, yeah.
Okay. And wanting to understand if they've had the vaccines, and for those who've had the vaccines, what were the factors that motivated them to have the vaccines? And if they've not had the vaccines, what were the reasons why they've not had the vaccines? We got a range of answers. to the questions, and in the actual numbers, 266 persons participated in the survey, of which 92% have had either their first dose, second dose, or the booster dose, whereas only 8% have had have not had the vaccines. It might be fair to say that the bias tended toward those who've had the vaccines, probably because they are most likely to respond to questions about vaccines. I'll take you through some of the slides, but the essence of it in terms of understanding why they've not, or why we're asking them to have the vaccine, majority of the numbers, 207, said they understood it to be to protect against COVID-19 and its consequences. Whereas a few numbers, about 3 people, said, well, they thought the vaccine is experimental and it's not yet been tested properly, and that might be why they're being asked to have the vaccine. The range flow from those who understood it to be to reduce or stop the spread of the COVID-19. 71 persons responded to that. To support the NHS and other essential services were 40. There's this point to make that the numbers may be more than the actual number of persons, because people were free to respond to more than one question in the survey. So in summary, majority of the respondents understood that the vaccines are aimed towards reducing the spread or to protect against COVID and its consequences. Then for those who've actually had the vaccines, we sought to know, why did you choose to have the vaccine? What motivated you to have the vaccine? Again, majority of them answered affirmatively that they took the vaccine in order to contribute to stop the spread of COVID-19. And then there were others who had personal reasons for their motivation, either because their relative had had it and their experience wasn't that good, or to support the NHS in order to maintain the NHS and prevent it from being overwhelmed. And as you can see, the range of responses varied from social responsibility, public health impetus, to also some of the personal drives to be able to, that motivated to take the vaccines. The spread of answers, as this slide shows, ranges from those who said, well, reducing the chances of being hospitalized was a key motivator for them to have the vaccine, and others who wanted the economy to be opened up and saw it as a way of contributing to their bid to opening up the economy. So again, the range of answers were relatively positive in terms of their responses. When we came to the few who, in terms of the refusals, those who didn't want to have the vaccines, there were quite a range of answers, ranging from concerns about the vaccine side effects, lack of trust in vaccine development and manufacturing processes, about 9 persons. There were concerns about the speed of development of the vaccine. Generally, some answered about low confidence in the vaccines, including both the importance, the safety, the efficacy, and also apprehensions about fertility, pregnancy, and breastfeeding. So there are quite different number of reasons by different respondents as to why they felt they should not have the vaccines. We did not set out to either debunk or affirm or in any way question the rationale or the validity of the reasons. We simply took note of what people felt were important for them and why they've not had the vaccines. So in summary, because this is more or less the key messages to take, we intend to take this information to feed into the design of the interventions targeted at the communities where we've observed there is low vaccine uptake in Birmingham. A number of the wards still have low vaccine uptake in comparison to England averages or even the Midlands average. That's in essence what the survey was about, and we will use it to input and improve the targeting of the vaccinations. Thank you. I will take questions on both the survey and the general responses.
Thanks very much, Lily. That's some interesting things have come out through this, I think. I was interested that I think it's the 3rd or 4th most popular reason for having the vaccine was to keep the economy going, which seems to me an odd explanation for why you would take something that's about your own health. But anyway, also some interesting comments at the end about why the reasons why people were not taking the vaccine. And it still seems to me that most of this is being driven by myths on social media and the internet and things that are just simply not true. But unfortunately, people believe. But any comments, Stephen?
Thank you for that. I mean, obviously, just to say, people unwilling to take the vaccine and fill in a questionnaire about it are quite a specific group. There'd be a big group who wouldn't do either. I wonder whether, given that there's information about all of those things in the public domain and we've been very heavily pointing people towards it, I wonder whether we've got a broader indicator here around trust in the system, and that there is information there, and it's just a question of it being believed. And one of the things that we need to do is to think about how we build trust in those communities that have got low vaccine uptake, so that they'll accept the information that's being provided.
Yeah, I think that's got to be correct, Hindi.
Yeah, that's correct, and we will be inputting that. Like I said, because of the current uptake levels within Birmingham and the fact that we're going to almost very granular level, both at the ward level, at the street level, and even the ethnic groups. Our plan is to tell all these messages, and we recently even received funding from the Department for Leveling Up in terms of addressing through COVID vaccine champions to be able to address the specific, more granular level information. So that is really part of the information we're getting, and that is why we're still asking these questions, is to enable us to tell all the information to be able to address the different communities. So yes, we will take that back and add it to the plans for the new interventions.
Thank you very much. I'm not seeing any other hands, so again, thank you. He will note that the survey and the outcome from it, and we'll move on now to test and trace budget overview. Justin?
Thank you, Leader. So the paper has been submitted to the board, and I won't put it up on the screen because I think colleagues have had it. Just to say, we have received confirmation again today from the Department of Health that the way we are managing the budget to carry forward and profile the budget to the end of the Commonwealth Games is appropriate and is in line with the comp funding, and they are supportive of the approach that we have taken, which is reassuring given some of the other challenges that there are around funding nationally. We are on track to have a relatively small underspend at the end of this financial year. We have been doing significant work since the last board met around ensuring that we are maximising the use of the comp funding across the breadth of the council in line with the guidance, and you will see that the projected commitments against the Wave 3 response has risen significantly, and that is changing the overall balance of the budget in this financial year. Those cross charges are coming through at pace at the moment, and really reflect the additional capacity, for example, that's been put into adult social care, some of the rapid work that we've done over the last year to adapt services to new ways of working so that citizens can still access support, and staff are able to work from home to provide that support. So there's been quite a lot of work to review that and to ensure that that is in line with the comp criteria. We've also talked to other local authorities to ensure that what we're doing mirrors what's being done in other areas, which I think has been really helpful because it has validated the approach that we've been taking in Birmingham towards the comp. The other thing I would just point out to the board in relation to this is that, as you're aware, we were able to leverage in additional funding, particularly around asymptomatic testing, but also around the community champions funding. And we have also received an additional 180,000 for additional work to support the vaccination programme over the next few months, which is now being mobilised by the Test and Trace comms and engagement team. And I think that's a reflection of the confidence that government have in the work that we're doing in Birmingham, and the strength of our work with communities and the partnership we have with the community and voluntary sector in this space, which is repeatedly being held up nationally as good practice. The other thing I should highlight to board in relation to this, for the budget for 22-23, we have agreed with the UK HSA that because we are retaining much of our structure in terms of our specialist public health and our environmental health capacity to support the response to Commonwealth Games, we will be initiating a programme of joint training with the UK HSA so that Birmingham will provide surge capacity should the UK HSA capacity buckle under a major incident or major event affecting any of the game sites within the West Midlands. We feel that's a responsible use of our capacity and reflects Birmingham's leadership about Commonwealth Games. And I would welcome the board's support in endorsing the offer that we've made to the UK HSA about that. And I'm happy to bring back to the board at the next meeting a more formal paper. It is something that was only agreed in the last couple of days with colleagues both regionally and nationally, but I think does reflect our commitment to have a safe and secure Commonwealth Games and to ensure that we are, as a council, supporting the breadth of the public health system around contingency planning for the Games. The paper does include some of the more details of clarification, and happy to take any questions from the board in relation to the budget and where we stand now.
Thank you very much, Justin. I'm sure you'll have the support of the board. We all want to see safe Commonwealth Games happen in the city next summer. Anybody, any questions or comments on Justin's report? Any questions about the budget? And I will take silence as agreement that we are supporting the proposition that Birmingham will supply surge capacity in the event of an outbreak of COVID at the Games this summer. I don't anticipate there will be one, but we do need to have these things in place just in case. Okay, we'll note that report. Thank you very much, Justin. Other urgent business? Does anybody have any other urgent business on the public agenda? No. Next meeting then will be at 2 o'clock on Wednesday, the 23rd of February, and again it will be an online meeting. Item 13 then is exclusion of the public in view of the nature of the business to be transacted, which is exempt under the law. The public, I move the public now be excluded from the meeting, which essentially means, Valina, if you could end the live stream.